It's a pleasure seeing you again.
Good morning, Dr. Velez. It's a pleasure seeing you as well.
Thank you for meeting with me today.
Of course, I'm always up for a therapy session.
So, I know you called me last week to tell me that you felt that you didn't need any counseling anymore because you felt lots of progress in your life. And at this point, you have finally felt in control of your symptoms.
Yes, that is correct. I've really seen the change in myself since I began therapy with you. You have strengthened me as an individual as well as helped me acquire the necessary techniques to obtain control of my panic disorder. I am no longer suffering from the symptoms that were occurring prior to therapy, such as my insomnia, shortness of breath, and feelings of worry and or panic.
That's so good to hear. I'm glad to see how far you have come since we first began. I felt that it was necessary to meet with you personally one last time because I feel that it is important to address your progress from our past sessions up until now. This will give us both clarity to make sure that you have all the necessary resources from me, and if there is anything further that I can assist you with or any questions you may have, we can also address those.
Thank you, Dr. Velez. That sounds great. Any resources you may have for me, I will be gladly to take.
Just know that I am here to help you navigate through anything you may need to go through.
Definitely. Your guidance has been extremely helpful, and I appreciate your expertise in counseling throughout these sessions.
Before we begin, I just want to remind you that all of what we discuss here today, as well as in our past sessions, is confidential, meaning that I am bound by privacy standards when it comes to everything we discuss during counseling. I do, however, have an obligation as a mandated reporter to report any safety concerns in which I feel that you may be a harm to yourself or others. Are there any other questions or concerns you have for me at this time in regards to HIPAA, privacy standards, mandated reporting, or any other general questions?
Thank you for explaining the following information, Dr. Velez. I am aware and understand the privacy standards required pertaining to our sessions. I have no further questions or concerns at this time.
Well, first, I do want to commend you for coming in today. Thank you again. Is there anything that has happened since our last session that you would like to speak about?
No, nothing that I can cross my mind this time, except that I have been feeling a lot of positive things in my life.
That's really good to hear. Well, because this is our last session, I want you to think back to your first day of counseling and why you came here. I feel like it is an important aspect to the discharge session to reflect on what brought you to counseling in the first place. At our first session, I had you complete the self-rated Level 1 cross-cutting evaluation to measure the symptoms correlated with your diagnosis. Briefly, I'm going to go over your answers you reported in the assessment.
Okay.
So the assessment consisted of a number of questions, and the scores were from 0 to 4. 0 being none at all, 1 being less than a day or two, 2 being several days, 3 being more than half the days, and 4 being nearly every day, making it severe. So I asked questions for how you were feeling within the past 2 weeks, how often they occurred, and if you were bothered by the problems. So for question 1, did you have little interest or pleasure in doing things? You scored a 2. For question 2, if you were feeling down, depressed, or hopeless within the last 2 weeks, you scored a 1. For feeling more irritated, grouchy, or angrier than usual, you scored a 0. For sleeping less than usual but still having lots of energy, you scored a 4. For starting lots more projects than usual or doing more risky things than usual, you scored a 0. For feeling anxious, frightened, or worried, or on edge, you scored a 4. For feeling panic or being frightened, you also scored a 4. For avoiding situations that make you anxious, you also scored a 4. For any unexplained aches and pains, you scored a 3. For feeling that your illnesses are not being taken seriously enough, you scored a 4. For thoughts of actually hurting yourself, you scored a 1. For hearing things other people couldn't hear, such as voices even when no one was around, you scored a 0. For feeling that someone could hear your thoughts or that you could hear what another person was thinking, you scored a 0. For problems with sleep that affected your sleep quality overall, you scored a 4. For problems with memory or with location, you scored a 1. For unpleasant thoughts, urges, or images that repeatedly entered your mind, you scored a 2. For feeling driven to perform certain behaviors or mental acts over and over again, you scored a 0. For feeling detached or distant from yourself, your body, your physical surroundings, or your memories, you scored a 4. For not knowing who you really are or what you wanted out of life, you scored a 4. For not feeling close to other people or enjoying your relationships with them, you scored a 2. For drinking at least 4 drinks of any kind of alcohol in a single day, you scored a 0. For smoking any cigarettes or chewing tobacco, you scored a 0. And for using any other medications or any medications at all, you scored a 0.
All right.
So from your scores, the primary issues we focused on during our counseling sessions were your feelings of panic or being frightened, and avoiding situations that made you anxious, your symptoms of depersonalization, restlessness, and muscle tension. To address those issues, we did a few exercises, if you remember those. One was within the scope of exposure therapy, and that was in order to control your panic attacks and the symptoms associated with them, such as your accelerated heart rate, trembling, sweating, and feelings of choking that you had. The purpose of this type of therapy was to elicit those symptoms and expose you to those feelings in order to train your brain into knowing that you're okay and that the situations that are bringing you a panic are not dangerous. You did mention in one of our sessions that you were having trouble in school due to your panic attacks and that you were trying to avoid public speaking within your courses, which was also affecting your grades because you thought your panic attacks would kill you. You also mentioned feeling as though you were losing control and that you couldn't handle your attacks anymore. So the idea of the exposure therapy was for you to face your fears so that you can better cope with these sensations instead of thinking that you were dying when you were having a panic attack, and to give you more control of your emotions. How did you feel about that?
Well, exposure therapy was a great method in assisting me with facing my triggers. For instance, the exercises which involve practicing rapid breathing and shortness of breath within 15 seconds at a time gave me the ability to have control over my diagnosis when I felt that I was in a state of a reoccurring panic episode.
Tell me more about that. In what instance were you able to use this technique out of our therapy sessions?
Of course. So in situations where I had to present in front of an audience, such as a class presentation or a work orientation, I took the time beforehand to practice the therapeutic techniques used in counseling to keep my panic episodes under control and stabilize my triggers.
I'm glad to hear you enjoyed the exposure therapy techniques. You were eventually able to recognize the symptoms for what they were and therefore feel better equipped to deal with the attacks. Because of that, I definitely feel as though you would benefit from using my colleague as a resource. One of my colleagues is a yoga practitioner. He also specializes in classes for deep breathing, and I think it would be very beneficial. His sessions meet on Mondays from 1 to 2 or from 6 to 7 p.m., and this is something you can further explore if need be. I would be glad to give you his number and more information once our session is over, just in case you need him as a resource.
That sounds great. I would definitely be open to joining those sessions to continue balancing my triggers and gaining more control over my panic symptoms.
I'm glad to hear that. Now, we also implemented CBT techniques into our sessions to focus on your symptoms of intense worries and anxiousness of going through a panic attack by using forms of cognitive restructuring. How do you feel that assisted you in handling your diagnosis?
I found the cognitive restructuring to be extremely helpful. It allowed me to become more aware of anxiety-provoking thought patterns and instead replace them with more balanced, less anxious thinking. By having the ability to reduce the intensity of my reactions to panic symptoms and fear situations, I was able to further reduce my anxiety and decrease the frequency, intensity, and duration of my panic symptoms.
Good. It appears that the cognitive therapy was very helpful for you during your time here in counseling. I think it would be a good idea to refer you to one of my partnered outpatient facilities that provide CBT sessions that would be a great help to you. In addition, I will be available for you to follow up with me once a week on your status during your time there if you feel that's something you may need.
Thank you once again, Dr. Velez. I always think that would be a great idea for me to continue CBT treatment since it has been very helpful for me throughout our counseling sessions.
Great. I will definitely provide you with the facility's information before you leave here today. You also mentioned during sessions that you were having physical discomfort such as aches and pains as well as trouble sleeping. We went over some relaxation techniques to assist in overcoming those issues. Have they helped you in your progression throughout your therapy?
Yes, the relaxation training was very helpful, especially in the beginning stages of my treatment for panic. Often I was increasingly anxious over time, so much so that my body felt overwrought with muscle tension, making me even more susceptible to additional anxiety. The relaxation training helped me with relaxation breathing techniques and caused progressive muscle relaxation, which decreased my physiological anxious arousal. This then helped me to reduce future vulnerability and panic to occur.
I'm glad to hear the relaxation training was also helpful for you as a part of our therapeutic techniques. Continue to practice these exercises in order to carry on with positive results. I will provide guidelines and instructions you can take with you regarding relaxation training in order for you to be able to continue practicing these techniques at home. I am always available for you to call if you do need any necessary assistance.
That sounds great. I will be looking forward to getting that information from you, Dr. Velez.
Lastly, you mentioned at the beginning of our sessions that you were suffering from depersonalization. Although there is no treatment for depersonalization, we discussed that as you gain more control over your panic disorder, the symptoms will begin to subside. In addition, we did go over various coping mechanisms to assist with the depersonalization occurrences. And with that being said, how do you think you will be able to cope with these issues now?
Well, thanks to the coping mechanisms you have recommended to me during our sessions, I feel that my depersonalization symptoms have decreased. For instance, pinching the skin on the back of my hand and holding an object at very high or low but safe temperatures when I feel the issue occurring. These techniques have helped me stabilize my mind and refrain from feeling detached from my body physically and mentally.
Great. Keep practicing these techniques and continue to stay consistent with them in order to obtain positive results. When you first entered counseling, you were also showing signs of emotional distress, anxiety, and panic according to the cross-cutting symptom measure checklist that I had you fill out during our intake. You also did mention in your questionnaire slight thoughts of causing harm to yourself because you felt that you were going crazy and no one was taking the severity of your symptoms serious. Although you scored low on the assessment, I still felt it was important to address is that if as of lately you have experienced any suicidal thoughts or ideations or hallucinations.
No, I have not been experiencing any thoughts of suicidal ideation or hallucinations at all.
Okay, that's good to hear. How functional do you feel you are in life right now?
As of right now, I feel that I am in a positive place physically and mentally and functioning at a good, stable pace.
I'm so glad to hear you are doing well. Do you feel as though all of the goals we discussed and targeted within our counseling sessions were met?
Definitely. I have gained the ability to overcome my symptoms and gain control over my panic disorder, as well as using the treatments provided to keep me on a positive path.
Before we end this session, I just wanted to go over cross-cutting symptom measure questionnaire I had you complete before our session began today. You scored at the highest domain when you initially took the assessment during our intake, indicating that it was necessary we follow up on your progress and initiate a second assessment to track any changes in your symptoms over the course of our counseling sessions and treatment. So again, the scores were from 0 to 4, 0 being none at all, 1 being less than a day or two, 2 being several days, 3 being more than half the days, 4 being nearly every day. So in the last 2 weeks, you were asked if you had little interest or pleasure in doing things, you scored a 0. Feeling down or depressed or hopeless, you scored a 0. Feeling more irritated, grouchy, or angry than usual, you also scored a 0. Sleeping less than usual but still having a lot of energy, you scored a 1. Starting lots of projects more than usual or doing more risky things than usual, you scored a 0. Feeling nervous, anxious, frightened, worried, or on edge, you scored a 1. Feeling panic or being frustrated, you scored a 1. Avoiding situations that make you anxious, you also scored a 1. Having unexplained aches and pains, you scored a 1. Feeling that your illness is not being taken seriously enough, you scored a 0. Thoughts of actually hurting yourself, you scored a 0. Hearing things other people couldn't hear, such as voices, even when no one was around, you also scored a 0. Feeling that someone could hear your thoughts or that you could hear what another person was thinking, you scored a 0. Problems with sleep that affected your sleep quality overall, you scored a 1. Problems with memory, you scored a 0. Unpleasant thoughts, urges, or images that repeatedly entered your mind, you also scored a 0. Feeling driven to perform certain behaviors or mental acts over and over again, you scored a 0. Feeling detached or distant from your body, your physical surroundings, or your memories, you felt a 0. Not knowing who you really are or what you want out of life, you scored a 0. Not feeling close to other people or enjoying relationships with them, you scored a 0. Drinking at least 4 drinks of any kind of alcohol in a single day, you scored a 0. Smoking any cigarettes, a cigar, or pipe, or chewing tobacco, you scored a 0. And using any medicines on your own without a doctor's prescription, you scored a 0. So, in that comparison of your scores, it shows that you are far more positive than when you first took the assessment. The severity and the frequency of your symptoms have significantly decreased with counseling. Do you feel that the scores are accurate to how you're feeling currently?
Yes, I feel that I am in a much positive space and see the progression since I first began in therapy.
Good. In order to maintain your progress, I will give you the information on the referrals we discussed. Is there anything else that you would like to discuss with me today?
No, I do feel confident now that you've answered all my questions and concerns that I did have.
Okay, well, I just want to commend you again on your progress thus far. I believe you will do great in life. You have so much potential to do great things, and you have overcome many hurdles within your diagnosis. Although this is our last session, please feel free to reach out to me as a resource, or if you think you may need additional counseling sessions, do not hesitate to call me. It was such a pleasure working with you.
Thank you so much, Dr. Velez, for all your help. I will definitely follow up with you regarding the resources you have given, as well as my progression and aftercare since my discharge.